Hi everyone, I want to talk a little bit about Katie Thurston's breast cancer diagnosis and a little bit about the type of breast cancer that she has in treatment. Katie Thurston is a former bachelorette, and she shared a few weeks ago that she'd been diagnosed with breast cancer. And recently we have this article that talks about she was diagnosed with stage 3 triple positive invasive ductal carcinoma. So what does this mean? Stage 3 breast cancer means breast cancer that has spread outside of the breast to the regional lymph nodes on that side, typically to the axilla or the armpit, sometimes above the clavicle or above the collarbone. Triple positive breast cancer means breast cancer that expresses the estrogen receptor, the progesterone receptor, and the HER2 receptor. And whatever receptors are expressed, we need to target them as part of our treatment. In terms of treatment, for HER2 positive breast cancer, for cancers that are 2 centimeters or greater or lymph node positive, we typically will consider neoadjuvant therapy, meaning chemotherapy and anti-HER2 therapy before surgery. There are exceptions, of course, but this is kind of the general. There are several different regimens that we can use for neoadjuvant therapy for HER2 positive breast cancer. One of the more common ones is TCHP, taxotere and carboplatin, which are chemotherapy drugs, and then we combine them with H&P, Herceptin, and Perjeta, which are anti-HER2 drugs. So you get neoadjuvant therapy, then we move to surgery. After surgery, we move into adjuvant therapy. And here is where we're going to think about radiation, if that's indicated or not. Anti-HER2 therapy, we know we need a year of anti-HER2 therapy, but the choice of therapy is going to depend on what we see at the time of surgery. Did the prior regimen eradicate all the cancer? If it did, we usually continue the Herceptin plus or minus Perjeta. If it didn't, and there was still some cancer seen at the time of surgery that was removed, then we usually will switch from Herceptin and Perjeta to a drug called Kadcyla, which is a different anti-HER2 drug. And then because she is estrogen and progesterone receptor positive, we're also going to add in anti-hormone therapy or endocrine therapy, which can either be with tamoxifen or an aromatase inhibitor, and then we consider menopausal status in there. Do we need ovarian suppression? So all of those decisions come into play. So you can see it's a lot of treatment, but we want to target all of these different receptors and utilize all of these different treatments to have our best chance of getting rid of the cancer and then reducing the risk of it coming back. Now, one of the things that Katie talks about later in this article is she talks about undergoing fertility preservation, and I really am encouraged to see that as being part of the conversation. It is really important that people with cancer be counseled on their reproductive risks before starting treatment, and if interested in fertility preservation or maybe uncertain about it, be referred to a reproductive specialist to discuss more to begin the process. Now, there are situations where there are oncologic emergencies and we can't wait to start therapy, and there are things that we can do here as well. The American Society of Clinical Oncology just updated their guidelines on fertility preservation, which I will share shortly. But if we're not dealing with an oncologic emergency, we usually can wait a few weeks to undergo fertility preservation before starting therapy. Here is where prompt referral and access is really important, because often people can undergo fertility preservation while still undergoing part of their cancer workup. So they might need to get an echocardiogram, they may need to get a port placed, they may need to get more biopsies or scans, and so a lot of those things can be happening simultaneously. But I really was encouraged to see this highlighted because it's such an important point, and we want to make sure that everyone has access and is offered fertility preservation. Let me know your questions about HER2 positive breast cancer, fertility preservation, anything that you heard me say in this video. Let me know in the comments.